Hello, everybody. I'm Peter Munich, Columbia University School of Public Health. And today I'm going to be talking about social policy for optimizing population health. It's going to be a little bit of an unusual talk. I'm going to focus more on macroeconomics and behavioral aspects of social policy, but I think you'll find the whole thing refreshing and new. So, the first point I'd like to make is that the health and well being of Americans is on the decline. Since about the mid 1990s, self rated health has been going down for the average American household. The second point to sort of make here is that wages are, not going down that much after adjusting for inflation. But after you adjust for health expenditures, expenditures on other survival goods like education and housing, compensation is declining, and it's declining in tandem with good health. Of course, correlation is not causation, but we'll get to that in a second. The health of Americans has been on the decline for decades, and it's been on the decline for blacks and whites. And even as the health of peer nations has been improving, the United States has not. So the United States has always been worse, but it's getting worse over time relative to our peer economic nations. So, what you've probably heard before is that economic distress is not good for you. It means you can't buy health insurance. It means you can't buy healthy foods. It means you can't live in a healthy and safe neighborhood. And you've probably also heard before that economic distress leads to psychological stress, and this psychological stress leads to physiological processes that are complex and damaging to cells, mostly through low-grade and chronic inflammation, and this causes premature aging. We start off young and handsome and end up looking like Rudy Giuliani. Why does this happen? Well, our bodies are adapted to dealing with acute stressors, predators, not chronic stressors that we see in day-to-day society. And these chronic stressors lead us to unhealthy behaviors. Why is that? Well, stress damages executive function centers in the brain, both acutely and chronically. And we know this acutely because we've been through finals and exams and under work pressure, and we know that when that happens, we don't take good care of ourselves. Chronically, it causes shrinkage in areas of the brain that are responsible for executive function. So that means that we're worse at making health decisions. We're worse at making plans and executing them. It makes it difficult to get things done in our life. All this has been known for a long time. This is a graphic from Bruce McEwen in 1996, which even at the time was a summary of his work. Another thing that you're probably aware of is that the social determinants of health are very important for health because they prevent health problems. And you probably also have a sense that policymakers can intervene on this process. We can reduce toxic exposures and accidents through social policy, and other forms of actionable social policy include, welfare policies. So in this review, we have many social policy experiments, 38 of them. We found that on average, income support programs and education programs do in fact improve health in cohorts of people, even if they're studied over relatively short periods of time. Let me just give you one really quick example: capping and filtering the Cross Bronx Expressway. This is a project that I'm working on. The Cross Bronx Expressway is the greatest contributor to PM 2.5 in New York City, and that is both due to the high volume of traffic on the expressway and also to the disproportionate number of trucks on the expressway that spew out diesel. And you can see that asthma rates are really high right along the expressway, right through the center of this purple area, which is actually the highest asthma rates, not just in the city, but also in the nation. And here's the expressway highlighted with noise maps. Noise, it produces not just insomnia, but mental illness. and cardiovascular disease as well, because it's very stressful. A lot of what we know about the literature on PM 2.5 comes from the smoking literature, tears up the DNA, affects basically every system in your body. And we also know, from international studies where there's a lot of air pollution, that it's leading cause of death in major urban cities, particularly in China and India. And there is no safe level of exposure to PM 2.5, but social policies can help. So, you put a deck park cap on top of a highway, and then you figure out how to filter the air, and build a nice park space and buildings and structures on top for people to walk and recreate. And you've got a good solution for public health. So there's an example of how actionable social policy can improve health. And, as I said, randomized controlled trials generally show that some social policies do what they're supposed to do. The thing is that the benefits of these social policies tend to be relatively modest. Okay, fine. So social policies tend to help population health, and we know that from experiments. So this is a causal study. So one of the areas that I'd like to talk about today is, how do we really think about this in the larger social and historical context? How do we think about this in terms of human institutions, human behaviors, social behaviors? And how is it that these social behaviors shape broader social institutions? So let's, of course, start with the historical context. At the end of World War II, the United States was the only real manufacturing center left standing. As a result, there were a lot of jobs here. The United States was making goods for almost everyone in the world, and you could make crappy cars and you could sell them because everybody else was still rebuilding their infrastructure. But over time, these jobs were slowly replaced by machines and software as the United States had to be more competitive in the global marketplace. And in addition to this, global competitors were automating their processes and building higher quality products. So this was really a race to who could replace humans the fastest. And we did a pretty good job of that. Most of the factory jobs that were blue collar and unionized are now gone. And those workers are now socially disadvantaged. They're now working 2 jobs at Walmart. About 60% of the jobs on the market today require a college degree, but only 35% of Americans have one. That means that there are not jobs for most Americans, even in a tight labor market. Another sort of macro factor here is that the United States is at the end of an economic cycle. It's at the end of its reign as a world superpower. It's had the reserve currency since the end of, World War II. And as a result, the United States has been able to disproportionately borrow money and build up debt. And the cost of labor and the cost of manufacturing got so high here that a lot of the jobs were outsourced. And if you look at an economic cycle, basically what happens is, a country rises as an empire. There's a period of peace, prosperity, and productive growth. That growth turns into a debt bubble. A dollar earned and a dollar borrowed are still a dollar. And so people borrow and they build wealth over time. But they also borrow to buy things that don't build wealth. And eventually there's a debt bust. And the government has to print money. to compensate for that. And as that happens, the empire starts to build a lot of debt, and it starts to become really expensive to do anything. Its rivals can make products more cheaply, and things start to decline. And that's really where we are now in an economic cycle. Well, what does this all have to do with health? Well, these changes come with changes to social norms. They come with changes to social institutions. They lead to social unrest. And this social unrest can arise from socially disadvantaged groups, and it can also arise between socially disadvantaged groups, as we're seeing now. Well, all of this suggests that if we are going to intervene on social disadvantage, we really need to think beyond traditional welfare policies. We need to think more broadly. What is it that we can do that will address the macroeconomic problems as well as the economic challenges that the households of everyday Americans are facing? What we're looking at here is a linkage between educational attainment and cardiovascular disease, cancer, infectious disease, and diabetes at the top. How do we get from educational attainment to disease? Well, one pathway leads to the right to occupation and income, and these are just some examples in which you can sort of trace this out. If you have a good job, you're going to have fewer stress factors in your life, stressful things happening in your life. You're going to have health insurance. If you have a bad job, you're going to be exposed to more stress, and you're not going to have health insurance. So, we need to think about this at the individual level, but education also serves as a macroeconomic remedy because it increases the competitiveness of the U.S. workforce in a global economy. And it increases the competitiveness of the U.S. workforce in the domestic economy. We are importing a lot of our knowledge economy workers. We have to, because we don't have enough of them. So if we're going to be thinking about the social determinants of health and coupling that with the needs of the nation in a changing world order to reduce social conflict, to get rule of law back in line, and to make the United States globally competitive again, we should probably look at what other nations are doing and what they're doing right. One example here is South Korea. Finland is another great example. And there's nothing remarkable about classrooms in these countries. They're very basic, not a lot of tech, teacher and a chalkboard. One of the main differences is that teachers have a lot of prestige. So, teacher prestige is one point of intervention. I think this is really the way that we need to be thinking about social policies. So on one level, what is it that's important for both the individual and society as a whole? What are the impacts of that social policy on social norms and social institutions? And how do we think about the weak points in all of our major areas of our social policy network? So let's take a look at three of these really quickly. Schooling, we've got unmotivated students, exhausted teachers. Teachers have low amounts of social prestige. And as a result, the United States doesn't rank very well internationally on education, despite spending more per student than any other country in the world. So what about healthcare? Well, we have a massively inefficient $3 trillion health system. The public sector alone, on a per capita basis, would cover every man, woman, and child if we had the National Health Service from the UK running our country. Instead, it only covers 20% of the population. It's bloated. There's a lot of redundant staff. There's a lot of redundant paperwork. You've probably all had the experience of filling out a form, not just every time you go to a doctor on a piece of paper, but sometimes the same form 3 times at the same visit at the same doctor. It's ridiculous. We also have a very weak income support social policy network. Countries like Estonia run e-government. What that means is that every citizen is linked voluntarily through all the government databases that can track that person's earnings and expenditures and predict their social needs. As a result, welfare is completely automated. You just get a check in the mail. In the United States, most people who are eligible for welfare don't even receive it because it's too difficult to get. There's a huge amount of bureaucracy involved in getting housing and getting health care and getting income support. And remember what I said before, executive function is damaged by poverty. So that makes it even harder to jump the hurdles of getting welfare. So let's take this advantage of this example of how we invest in education. So what are some of the examples of things we could do? We could invest in pre-K programs. We could try and improve teacher prestige. We could reduce class size. We could improve the architecture and appearance of schools. There's a lot of things we can do. This is a picture of a classroom in one of the top-ranked places in the world, Shanghai, China. You can see that classrooms look pretty different there. Class sizes here have been shown to be linked to better education outcomes because the students get a lot more attention from each teacher, and that impacts them throughout their life. We can see here that students that are out-competing us despite having overcrowded classrooms and despite having suboptimal learning environments in some ways. What's the difference? Well, the attitudes of the students, the prestige of the teacher, and the rigor of the curriculum. Here's a classroom that is, just fortified with an overhead projector. That's really basically all you need to teach a class and to teach it well. Teachers are the major determinants of how well you do with your education system. So, one idea here is that you can simply increase the wages of teachers, make it more competitive. If you're a teacher in a bar and you're single and you're talking to somebody and you tell them what you do, they're probably going to excuse themselves and go to the bathroom. In Finland, they're going to snuggle up closer to you. This is a major problem that teaching is not perceived as a high prestige occupation in the United States. One way to make it more competitive and more prestigious is to simply increase the pay of secondary and primary school teachers. It's just an idea, though. We really need randomized controlled trials to test to see if, increases in pay in a particular region of the United States might make an impact. We need more studies to be done. There's a lot that's still to be done. I'm going to end here in the recorded portion of my talk, and I hope you enjoyed this. This is for participants who couldn't make it, and I'm looking forward to talking to you one-on-one as the conference goes on.